Now I will discuss common myths related to IVF. One myth that is very common is age is just a number. No, it is not so. Although IVF can be done in any age group, but IVF success rate, as I've already discussed, depends upon age. So if it's in 20s or early 30s, the chances of success of IVF is more as compared to the later age group. Second common myth is that IVF is a painful procedure. Well, thanks to the technology, the injectables that are being used in IVF are now like pen manner, so it's not very painful. Besides the ovum pickup, in which retrieval of follicular fluid and egg, in that we use sedation or anesthesia. So IVF is not a very painful procedure. Third common myth is that IVF babies are not normal babies or they face problems in future. Well, IVF babies are just like any other normal baby. So it's a totally myth. Next myth is that women who have conceived through IVF, they need bed rest throughout their pregnancies. Well, it is not so. Although the age group in which IVF is done, a later age group, there are chances of having comorbid conditions and complication, but that does not require complete bed rest. So women who conceive through IVF pregnancies does not require absolute bed rest throughout pregnancies. Next, that IVF is a very expensive procedure. Well, it depends upon the cause of infertility and what is the underlying procedure that you will go through. That will determine the cost of IVF. So thinking right from the beginning that IVF is very expensive is wrong. Next myth is that IVF causes multiple babies. Well, it depends upon the number of embryo that have been implanted in the uterus. Now the more advanced technologies, usually the most healthy embryo is selected and that is introduced. So that IVF procedure will definitely lead to multiple babies is wrong. Next, IVF in obese people is not possible. Well, this is wrong. The success rate decreases, but altogether it's not possible is wrong. Next myth is that IVF drugs causes cancer. Well, it is not so. This has been seen in various studies and it has been said that IVF drugs can be used and they do not cause cancers. Next myth is that IVF is the only option in the infertile couples. This is also wrong. Before going to IVF, the infertile couple is undergo thorough evaluation and depending upon the cause, the treatment is given. And if couple conceives through it, then it's well and good. And IVF is done only for the indications as I've discussed before. So it is not the only option for the infertile couples. Last myth is that IVF can be done only in infertile couple. Well, that is also a bit wrong because if any of the parent is having genetic disorder, then in that also the healthy sperm or a healthy egg is selected and that only is implanted into the uterus. So parents with genetic disorders can also have babies through IVF. Besides, if the partners are of the same sex and they want to experience parenthood, so depending upon the donor egg and donor sperm, they can have babies.